More because some people may not know what their income is for the year. Self-employed people or people who are still looking for a job and they're currently on unemployment or something. So that pot there kind of leaves them some wiggle room because if their income is higher, the government doesn't come after them for the tax credit that they received that they didn't have the rights to. They'll just go into that pot and take that money. But if you do report your income and at the end of the year your income is $1,000 more, $2,000 more, what's going to happen is the government on your tax credit will say you actually owe us for that extra money that you received every month that you didn't have the rights to because your income is actually higher. Also happens the other way around. If you report that you're going to make $15,000 and you only make 12, at the end of the year the government will say, well, actually you pay more than you had to every month, so here's some money back to you right now. So people can choose how to take the tax credit, and we experience some people even just over-reporting their income just to be safe. So they think they'll make $17,000 to put in there. I'm going to say I'm making $17,500 just in case something happens. I have some wiggle room in there. Is that better explained? Thank you. I'm going to talk a little bit about how to apply for the marketplace. There's a lot of different ways that you can apply for the marketplace, and there's three major categories. One is through MDwise, the second one is through Health Navigator, and the third one is through the government directly. Through MDwise, there is three different ways you can apply. We have a direct enrollment website through MDwise.org, through our website. We also have our call center, and there are blue cards that we can pass around after. It's an 855 number that people are welcome to call. Again, they can help you with some basic questions, and they can also do your application over the phone. And the third way is just to talk to an outreach coordinator such as myself. We're doing one-on-one meetings with people to kind of answer their questions specifically because everyone kind of has a special situation, and it's not always comfortable to do in front of everyone to say your health needs and things like that. So we do one-on-one meetings with everyone. And then after we answer the questions, we help them with the application. Now, through a Health Navigator, these are people that are paid through a federal or state grant, and they're not associated with either insurance company, so they're kind of impartial. And there are hospitals, Ashkenazi has Health Navigators, I believe IU Health may have Health Navigators, St. Francis does. Again, these are impartial people that you can talk to and help with your application. Again, my one advice would always be to, even if you talk to a Health Navigator, ask them about the plan's network coverage, because you want to be sure that the doctor you want to see is in your health plan, because if not, you're going to have to pay out of pocket. And the third way is an application directly with the government, and there's three different ways that you can do that. One is to go on the healthcare.gov website that we heard a lot on the news at the end of last year that wasn't working. Yes, it's back up and running, and each day it works a little bit better. So it's getting there. It's getting better. The third way is to also call the healthcare.gov number, and I have that number if people want to write it down. The number is for healthcare.gov is 800-318-2596. They're open 24 hours a day, 7 days a week, and they also speak a lot of languages. And I'm just going to go ahead and also give the MDwise number.
Sorry, the first one, healthcare.gov.
Healthcare.gov. Yes, healthcare.gov. And the MDwise number, if anyone wants to call our call center to do the application of the phone or ask some specific questions about MDwise, that number is 855-417-5615. And they're open from 8 in the morning to 8 at night, 7 days a week. And they also speak many languages in the call center, so just feel free to ask them if you have any language barriers. And technically, there's also a third way to apply for the marketplace to the government, and that's through a paper application. My recommendation personally is not to go through that route because that can take a much longer time for you to fill it out through the paper, send it through the mail. By the time they get it, they process it all. It can take many more weeks. If you do it over the phone or if you do it over the internet, next day your health insurance plan already has your information on hand and they will already start contacting you about who you want your doctor to be. You make that first payment and you get that confirmation that you're in our plan. You don't have to wait 2-3 weeks and don't know where your application is. So I'm going to talk a little bit about the penalty right now because that's also a hot one. The penalty for not having insurance for the first year will be $95 or $47.50 for children, or 1% of the income for the household. Whichever one's higher, the government will take from your tax when you apply for your tax credits. Again, these are just for the people that are legally in the United States and are eligible for health insurance and do not have it. If someone does not have Social Security or does not file for taxes, they don't have to worry about the tax penalty because they're not eligible for the marketplace or any other health insurance. And that's why it's important people have Wisher Advantage just to let them know that they might want to make sure that they're either not eligible for the marketplace or they get a marketplace policy. The penalty will also increase in the following years. In 2015, the penalty will be $285, and in 2016, it will be even higher. I think it's about $600 per adult.
Is it per month or per year?
For the year. For the year. So they'll collect it when you apply for your taxes. And just be aware that the tax penalty did not apply for 2013. So when you apply for your taxes for 2013, in 2014, you will not get penalized if you do not have insurance. We are yes. So the law was not in effect for 2013, so you will not have to pay that penalty if you do not have health insurance 2013. We're hearing that this year, if you apply for your taxes for 2013 and 2014, they're already asking, did you have health insurance? They're asking that question, but you will not be penalized. The penalty starts for 2014 when you apply.
No, because they are not, when you are, this year, they're not going to penalize you because you are filing your tax, but when you are filing your tax next year, then you will be penalized. If you can shed more light on it. The thing we are hearing is this. Actually, you just got to that place. I'll be wanting to ask that question. If you don't, I'm not saying I don't want to, but if you don't get the health insurance by, do they say March
31st.
What will happen to me?
When you apply for your taxes in 2015 for the year 2014, they'll ask a question, did you have health insurance? And if you click no, you get penalized $95 per adult, $45.50 for children, or 1% of your income for the household, whichever one's higher.
Okay. Hello. Now, for 2013, we are filing tax now.
Yes.
For 2000 then we need to get insurance by March this year.
March 31st of this year.
And we are filing tax in 2014. So no penalty now.
There's no penalty when you file your taxes for the year 2013 right now.
Right now.
Yes. So again,
even if I don't have health insurance by.
Yes, even if you don't have insurance by March 31st, because your taxes that you're filing right now are only for the year of 2013, when the law was not in effect. So they cannot penalize you for that year. So again, if you decide, for example, not to go with insurance for the year 2014, you will pay a $95 penalty for adults in 2015. But again, if you do not have in 2013, you don't have to pay that tax right now, this April, this tax season, will be collected.
initially what we had is that the penalty is up to $2,000. But because I want you to lay emphasis on the reason why people need health insurance. Because now everybody decides the penalty is not too much. The next thing they don't want it. and it's a very wrong thing because they start assuming that penalty, we need to let them know the importance when they really need health insurance.
And again, one of the things is that for the first year, $95 or 1% of your income may not seem like a lot, but if you think about it, you're paying 1% of your income to not have any coverage when you might be paying $80 or $70 a month to have excellent coverage in your health. Here in the United States, again, Wisher Advantage is not going to go away, but you will not be eligible if you're eligible for the marketplace. So if you do need to seek medical services and you don't have a Wisher Advantage or you don't have insurance, those costs add on really quick. One of the main reasons why this law went into effect is that I think it was either a third or 2/3 of all home foreclosures were due to crazy health costs that people could not afford anymore, so they had to sell their houses. And that's one of the main things, that if you're paying $95 just to not have health insurance, think about maybe you're going to be paying a few more a month, but you're going to have 94% coverage, or if you ever have an accident, you're fully covered. You know where your expenses out of pocket will be. Because again, here, anything can happen. You're healthy one day, the next day you go to the doctor and you find you have something. And again, after March 31st, you won't be able to apply for insurance anymore. So, and if you have something, you're paying a lot of health bills, the government will still also get you on the penalty because you didn't have health insurance. So, again, a lot of people probably do have Wisher Advantage, and again, just be aware that if you're eligible for a marketplace, Wisher will tell you to apply for the marketplace so you can keep your Wisher Advantage.
But you still need to apply for the marketplace.
Yes, yes. Wisher Advantage is continuing, but they want everyone that's eligible for the marketplace should go into the marketplace. And then they can come back and apply for the Wisher Advantage. You have it kind of as a secondary. So if you have the marketplace and you go to Wisher, you get a discounted price from the marketplace. So your co-pays, if you go to your doctor, will be discounted because of your Wisher Advantage if you have Wisher Marketplace. I know that gets a little confusing. Again, my advice is always to go directly to the source and talk to them. So if you have Wisher Advantage, just call Wisher and just say, this is my situation. I'm just wondering, am I going to be eligible? And if yes, do I have to apply for it? What's the process? When can I come back and apply for Wisher Advantage? And things like that. You do, because Wisher Advantage is a discount program, so you're still eligible for the tax penalty if you have Wisher Advantage.
Please, can we keep our conversation down? This is very important. Let's keep our conversation down.
Ask questions. Don't. That's why he's there. Ask from him.
Yes.
Don't discuss. Ask from him.
I'm just going to answer it. Yes.
So even though you have Wisher Advantage, you still have
Yes.
Yes, you still have to have marketplace because Wisher Advantage doesn't cover the 10 essential benefits. Wisher Advantage is a discount program and not health insurance. So the government doesn't consider it one of the health insurance that will prevent you from getting the penalty. And again, Wisher Advantage, when you go into renew your Wisher Advantage, they will tell you they had to apply for the marketplace if you're eligible. So they can help you also with that.
One question is, so by this, March 31st, if you don't apply, you're not allowed to apply?
You're not allowed to apply unless you have a special enrollment kind of eligibility. And that eligibility is if you gain a dependent, if you lose a dependent, if you lose your job, if you change jobs, those kind of things will open a special enrollment period for you that you have to report pretty much saying, I'm applying after March 31st because I had a child or a child moved out of my taxes.
So, say, for the year, that's for the year, so after that. So, after, like, say you're not allowed to apply for 2000. So you're not allowed to apply for 2014, so you'll be open for enrollment 2015.
Open enrollment for 2015 will be, I think, November to December, is what they've been telling us right now.
But still, I mean, so far you didn't apply March 31st, you have the opportunity to apply by March, by whatever it is open to the next year.
Yes, and your coverage will start January 1st of the next year.
Okay, and then you'll be charged for the year.
You'll be charged for 2014 because you didn't have 2014.
But the implication is this. If you don't apply by March 31st, if you don't apply by March 31st, God forbid, if you fall sick, if anything happens, you are paying out of your pocket.
Yes, and you are paying for the
If you don't
penalty as
apply
well.
by March 31st, if you don't apply by March 31st and you think because there will be another opportunity in November, if anything happens between March to November, you are on your own.
And the November opportunity, is also for 2015. So even if you apply November for 2015 and you get sick December of 2014, you're still out of your pocket. Okay, so
my question is, you said if something happens, you are going to pay out of your pocket, right?
Yes.
So, but the point is, you still have the WeChat Health advantage, right? So, can they get you covered? I mean, even though if you don't have the insurance.
they can, but again, they will try to, Wisher Advantage will tell you that you have to apply for Marketplace to keep your Wisher Advantage. And that's their policy right now from what I'm hearing.
Yes.
So if you are eligible for the Marketplace, Wisher Advantage will not let you just have Wisher Advantage. They will tell you you have to apply for the Marketplace so that you can then have the Wisher Advantage. But let's say you're not eligible for any reason, you're over 65, you're not legally in the United States, or maybe your Medicaid level and things like that, you might still be able to keep your Wisher Advantage and not have to have that Marketplace policy. But that's why it's always better to talk to Wisher directly to see what their eligibility process is. They can help you if they say you have to apply or you don't have to apply. Because you don't want to be paying out of pocket thinking you can have Wisher Advantage and you go in, they said you actually don't have it because you're eligible for the Marketplace and you don't. So.
My question is, why if I apply for MDwise and I lost my job, I cannot afford it anymore? What do I do?
These plans are month to month, so at any point you can just cancel your health plan, and then if you lose your job, you'll be eligible for Medicaid, because more than likely your income will fall below 100%. Or, for example, let's say your spouse is still making enough to put you over 100%. What will happen is you call MDwise or you call healthcare.gov, and we help you change your income level, and therefore your premium will be reduced because your income is going to be less. But again, more than likely, if your income falls below 100 because you lose your job, you cancel your Marketplace policy and you apply for the Medicaid programs and the Healthy Indiana plan, the HIP. Is that a question?
Can I be specific?
Yes.
Because you are
Because you are here today and actually I have an idea of MDwise. And I will prefer MDwise, personally. And now, I want to be specific. I have a family of 6. And the income is below 60,000. So, I want to be specific. Just let me have an idea of what do they pay monthly. That will help a lot of people. So, we just see all this 100%, 100%. Let's just have an idea. So that will help.
For the example, do you have ages that you want to put in here as well? There are ages. How many adults over 21? Ages. So just maybe what I can do. And again, the example we did for a family of 6 with about $60,000 of income for Marion County with 3 adults enrolling, the plan will cost $295 a month for a plan that covers about 87% of your medical expenses for the year.
Does that amount include like vision, dental? Does it include vision, dental?
No, the marketplace plans do not include vision or dental, but they do include vision for children.
It includes vision for children?
Yes.
Does it include dental for children?
No.
So that amount you're paying monthly, that would just be for
Health.
health?
Just for health.
Like if you had like surgeries?
Yes. Yeah. Dental, emergency dental is covered, but not routine dental care. Like that. So, let's say you're in an accident in your job, you need surgery, that will be emergency dental.
Please, as we are rounding it up, we want to give him the opportunity. I mean, he's passing out his card, then we can call him for further clarification.
And this is just the last part of the presentation, just again a little bit more about MDwise, just get more familiar on why you choose MDwise, maybe over a competitor. One of the things is that we're the only nonprofit insurance company here in Indiana, so we're run very different than the for-profit insurance companies. For example, 95% of our members will recommend MDwise to their family and friends, and we believe that's a high number because we all dealt with insurance companies and we know they just sometimes give you the runaround. I had a car accident, it took them a month and a half to figure out whose fault it was and how to get reimbursed, so I'm happy with our satisfaction rate. Another one is again our coverage of the 4 hospitals, IU Health, St. Vincent, St. Francis, and Wishart, or Eskenazi. That makes up about 1,400 primary care doctors that you can see in Indiana, and that's also 9 out of the top 10 hospitals in Indiana that you can seek services at and still be considered in network. And again, we also have plenty of experience with people with Medicaid, so you may not have heard of MDwise, but we've been around since 1994, and we have plenty of experience with the insurance companies as well. So.
Before you finish this question, you said this thing doesn't cover dental and vision.
Yes.
Do they have to second insurance then, or something?
If they want coverage for vision and dental, they do have a second. They have the option of getting a second one, but not through MDwise. We don't offer those. There are some dental policies available through the marketplace, through healthcare.gov, and there's 3 different companies. Again, we don't offer one, so I'm not familiar with what they cover, but it is a possibility for them. But penalty-wise, they only have to worry about their health coverage. It doesn't apply for dental and vision and things like that. And vision is covered for children under the marketplace plans.
Any other question? Any other question? Yes. Go ahead.
Either one, I'll get one in the other.
You want to ask questions? Please.
On that cat insurance, there's medical insurance under the car insurance. So is it still okay for us, since everybody's going to be having health insurance? Is it still okay for us to keep the medical insurance under the car insurance, or we can just take that out of our premium for the car insurance and just have the health insurance?
The Medicaid insurance?